Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, but we're going to be covering acute kidney injury. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, you'll find plenty of resources. You can get audio lessons. You can sign up for a private one-on-one tutoring session with me. You can pick my brain about something, sign up for a consultation session. Or if you're studying for your boards, you can sign up for next generation NCLEX review session with me, part 1 and part 2. Again, my website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, right here on YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Acute kidney injury. First question. Select all that apply. What are the main characteristics of acute kidney injury? Select all that apply. Remember, guys, how do you treat select all that apply? As true or false? Here are your options. Increase BUN, decrease BUN, increase urine output, decrease urine output, increase creatinine, decrease creatinine. What are the main characteristics of acute kidney injury? Okay, very good. Increase BUN, increase creatinine, decrease urine output. The kidneys are responsible for filtering the blood and taking all of the poisons, all the bad stuff that's in the blood, taking it out, right? And it comes out via what? Your urine, right? So when the kidney's not working the way it's supposed to, if the kidney's in trouble, you're going to see the BUN elevated, you're going to see the creatinine elevated, and you're going to see urine output what? Decrease. Think about it. The job of the kidneys is to produce urine. That urine is all of the crap that's in your blood that shouldn't have been there to begin with, right? All of that nitrogenous waste. I shouldn't say crap. I should speak more like a nurse. All the nitrogenous waste products, right? That's in your blood. The kidneys filter it out and it comes out via urine. So if your kidneys aren't working the way they're supposed to, you're going to see urine output decrease. A couple other things you guys need to know. If you're asked between BUN and creatinine, which one specifically will give you an indication of kidney function? What is the correct answer between BUN and creatinine? Which one is specific to the kidneys, guys? Very good. Creatinine. Very good. Something else you also need to know when it comes to urine output, a patient should be excreting at least 30 milliliters of urine per hour. At least. That's the minimum. True or false? A complication of severe acute kidney injury is azotemia. Is this true or is this false? A complication of severe acute kidney injury is azotemia. True. What is azotemia? That is the accumulation of waste products in the blood. Remember all those waste products that I just talked about? I called it crap. But the waste products that I told you that's in the blood, that the kidney's responsible for filtering it out and it comes out in urine, right? If the kidney's not working the way it's supposed to, all of that waste product remains in the blood, okay? And it basically turns into poison for the patient. So you're seeing that urea nitrogen and that creatinine accumulating in the blood. No, there's a difference between acute kidney injury and chronic. This is acute. Okay, true or false? Potassium is expected to be decreased in AKI. Serum potassium is expected to be decreased in acute kidney injury. Is this true or is this false? That's right, false. It's going to be increased because think about it. Sodium, potassium, those electrolytes that you usually find in the urine, If the kidney's not working the way it's supposed to, you're not urinating the way you're supposed to, so it's going to be accumulating in the body. So we don't expect to see the serum potassium decrease. If the patient has acute kidney injury, it would be increased, and that's a big problem, because remember, potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything over that, the patient's at risk for what? Cardiac dysrhythmias. So we're really nervous about that with that potassium accumulation. That therapeutic range is very narrow when it comes to potassium. Ordered response. Prioritize your nursing actions for a patient in acute kidney injury. What are you going to do? Here are your options. Maintain INO and administer diuretics as ordered. Prepare the patient for dialysis if indicated. Teach the patient about limiting protein and sodium in the diet. Monitor serum electrolyte levels and watch for hyperkalemia. Prioritize your nursing actions for the patient that is in AKI. Only 22 people got this correct. So the first thing you're going to do, guys, come on. Nursing process, assessment, get information. The first thing you're going to do, monitor electrolyte levels and watch for hyperkalemia. If the kidney's in trouble, patient's holding on to potassium, we're worried. We're going to be looking at the potassium levels along with the other electrolytes. But guys, by the way, when it comes to electrolytes, the two deadliest ones, the ones you're going to be concerned about the most, is going to be one, potassium, because I'll kill you fastest. And right after that, it's going to be sodium. All right. But anyway, you're going to be watching the electrolyte levels. You're going to be looking at the ECG. You want to make sure patient's not having any arrhythmias. We're going to be concerned about hyperkalemia. After that, maintain INO and administer diuretics as ordered. You don't think you're going to look at those electrolytes levels before you administer a diuretic? Are you serious? Of course you are, right? So, and you're going to look at, assess the electrolyte levels, assess the patient for hyperkalemia. You're going to go ahead and do the INO on the patient. You're going to administer the diuretics as ordered. After that, if you have to, because it hasn't worked, right? You gave that patient diuretics and it's not working. Unfortunately, patient's going to have to get dialysis. Prepare the patient for dialysis if indicated, right? If you have to, you got to do it. And last, this is always last, guys. Whenever you have to prioritize your actions, teaching is always last, because we never teach a patient until they're stable. You have to stabilize your patient first before you ever start any teaching. So whenever you get a question about prioritization or it's an ordered response, you're always going to start with assessment. You have to get information before you can do anything for your patient. And you're always going to end with teaching. Teaching is last after your patient has been stabilized. Okay. Your patient's experiencing oliguria. Which of the following findings would you anticipate during the stage? Sorry, can't read. Decreased serum potassium levels, increased serum creatinine and BUN, increased urine output and decreased urine specific gravity, or decreased blood pressure and tachycardia. So your patient's experiencing oliguria. Which of the following findings would you anticipate during this stage of AKI? They are oliguric. What would you expect to find? Very good. Increased serum, creatinine, and BUN. We expect the BUN and creatinine to be increased. Kidney's not working the way it's supposed to. That's why they have oliguria. What's oliguria? They're not urinating. No or minimal urination, right? Look at the wrong answer choices. Decreased serum potassium levels. If they're not urinating, they're holding on to the potassium. If anything, the potassium would be increased, not decreased. So that can't be it. Next, increased urine output. literally oliguria is decreased or no urine, right? So it can't be increased urine output. It would be decreased urine output. That's wrong. And decreased urine specific gravity, guys, if the patient has oliguria, the little bit of urine that that patient does release is going to be concentrated. So the urine specific gravity is going to be increased, not decreased. So that's wrong. And then last, decreased blood pressure and tachycardia. Think about it. If the kidney's not working the way it's supposed to be working, it's not releasing urine. Patients got oliguria. They're not urinating the way they're supposed to be. They're going to be holding on to fluid. If anything, the blood pressure would be what? Increased. Does that make sense to you guys? Okay, let's keep going. If you don't have any questions, I'm going to keep going. All right, type in your answer. The patient in acute kidney injury experiences metabolic what? Metabolic what? If the patient's in AKI, what are they experiencing? Type in your answer. You guys are doing great on the live. You're redeeming yourself. Cardiac alkalosis syndrome, acidosis. Very good. All right, most of you guys got that right. The patient in acute kidney injury experiences metabolic acidosis. And think about it. What are one of the things the kidney's responsible for? Making bicarb. Bicarb production. If the kidney's not working the way it's supposed to, it's not going to be making the bicarb, right? And not only is the kidney not making the bicarb to buffer things out, right? It's not being reabsorbed because the kidneys are not working. So the patient is losing bicarb. So that throws them in the opposite end. Okay. Instead of alkalosis, acidosis. Very good. Correct. HCO3. Okay, what does it say? Which of the following interventions would you expect to reduce the risk of further kidney damage when giving diuretics? Would it be to stimulate renal tissue repair? Would it be to prevent hyperkalemia by increasing urine output? Would it be to decrease the patient's metabolic rate? Or would it be to increase protein filtration by the kidneys? Which of the following interventions would you expect to reduce the risk of further kidney damage when giving diuretics? Very good. To prevent hyperkalemia. And how do we do that? By increasing urine output. The more that patient urinates, the more the potassium's coming out of that body through the urine. That's how we prevent that hyperkalemia. It couldn't be to stimulate renal tissue repair. Diuretics don't do that. It could be to decrease the patient's metabolic rate. Diuretics do not do that. And it couldn't be to increase protein filtration by the kidneys. Diuretics do not do that. Diuretics make you release fluids. And in that fluid would be electrolytes such as potassium. True or false? A known therapy for elevated potassium in AKI is regular insulin given intravenously. Is this true or is this false? Is regular IV insulin a known therapy for a patient with elevated potassium that's in AKI? True or false? True. True. Insulin pushes potassium back into the cell. So here's what we do. When that patient is hyperkalemic and it's bad and we need to get that potassium lowered. They're going to get insulin. It's going to be regular insulin. It's going to be IV, so we can push that potassium back in the cell. And here's what's so crazy. At the same time that we're giving them the insulin, we're also giving them what, guys? At the time we're giving insulin to push potassium back, no, SAS baby, no. What are we giving? Not fluids, not Kayexalate. Thank you, dextrose. We're giving glucose, guys, and here's why. We're giving insulin to push potassium back into the cells, but at the same time, what does insulin do? It lowers the glucose level, right? Number one, you lower patients' glucose level too fast, you're going to either make them go, what's the word I'm looking for? They'll be unconscious, or you can cause seizures if it drops too fast. So that's two things we're concerned about. And the third thing we're concerned about, we're trying to push potassium into the cells. We're trying to lower the potassium level, but at the same time, we're not trying to cause a hypoglycemic reaction. All right. So that's very important for you guys to know. Very good. True or false? A known therapy for elevated potassium in AKI is sodium bicarb. If the patient's in AKI and the potassium is elevated, a known therapy is giving sodium bicarb. Is this true or is this false? Very good. True. How did 31 of you guys choose false? I gave you a whole explanation about how sodium productions decrease because the kidney's in trouble. I'm saying sodium, excuse me. Bicarb production is decreased because the kidney's in trouble, and how bicarb isn't even reabsorbed. So yes, we're going to do what? Replace it. That bicarb helps to correct that acidosis by what? Pushing that potassium back into the cells, guys. That's what's causing the acidosis. Two more questions, true or false? A known therapy for elevated potassium in AKI is magnesium sulfate. Is that true or is that false? So far, we've talked about bicarb. We've talked about insulin. Now they're asking us about magnesium sulfate. Is this true or is this false? If your patient's in AKI and they've got elevated potassium, is magnesium sulfate a known therapy? True or false? Very good. I thought I was going to trick you. Most of you guys chose false. I'm disturbed by 19 of you that chose true, but this is false. So guys, it's not magnesium sulfate. What is it that we give that I haven't spoken about? Does anyone on the live know? Calcium gluconate. Very good. Calcium gluconate is given. So this patient's potassium level is elevated. They're having cardiac dysrhythmias. The ECG is looking crazy. We're going to go ahead and give them calcium gluconate. Calcium gluconate increases that threshold for cardiac excitability. So calcium gluconate, regular insulin IV, bicarb, these are known treatments for hyperkalemia in the patient that has AKI. Yes, you need to know this. I'm telling you, you're going to see it some way, somehow. Type in your answer. This therapy used in AKI works in a short time, and it is the most effective therapy to remove potassium. What is it called? What is it that we do for this patient? It's the most effective way to remove potassium, and it's done in a short time. How do we remove that potassium quickly? And it's the most effective way. Very good. Albuterol. Girl, bye. Insulin, hemodialysis. Let me see what you guys said. Kayexalate. I'm going to talk to you about Kayexalate. That's not the answer. Sodium. No. Why would we give them sodium to make them hold on to even more fluids when they're not letting go of fluids? Are you serious right now? Lasix. Okay. So the correct answer is dialysis, guys. Hemodialysis. All right, true or false? A priority nursing intervention is to teach the patient to avoid sodium polycystine sulfonate. Is this true or is this false? A priority nursing intervention is to teach the patient to avoid Kayexalate. Is this true or is this false? It's false. This is a known treatment for hyperkalemia and AKI. So known treatments in hyperkalemia and AKI, regular insulin IV, bicarb, calcium gluconate IV, and Kayexalate. Of course, hemodialysis as well. Kayexalate, guys, this is mixed with water. The patient drinks it, and what happens is it causes osmotic diarrhea, and so the patient will have diarrhea, and the potassium comes out of the stool. But if that patient's potassium is very, very high, and we need to lower that potassium now, this is not going to be our choice because this takes time. It has to go through the GI tract, right? It's most likely going to be what? Dialysis. Let me ask you guys something. Would this be a good choice? Would you expect to give this for a patient that has a bowel obstruction? Can you give Kayexalate if the patient has a bowel obstruction? True or false? Yes or no? No, because again, it has to go through the GI tract. So that's a famous test question as well. You guys got to know that. Yep, the potassium is lost through the diarrhea. Very good. And that's it, guys. There were just 12 slides on acute kidney injury. I think I'll make the next Kahoot on chronic kidney injury so you guys can see the difference between acute and chronic. Let me know on the live or in the comment section if you'd like to see that next or if you'd like to see something else. But in the meantime, let's see how you guys did.